Hi everyone, my name is Layali Al Juda. I'm a pediatrician originally from Palestine. I completed medical school and pediatric residency there, after which I worked independently as a pediatrician for a couple of years before immigrating with my family to Canada. And as other international medical graduate, I have been always looking for opportunities to advance my medical practice. Um, my journey here started from the master's in medical genomics, and because I have been always interested in knowing more and managing more kids with metabolic disorders, I pursued a fellowship at the Hospital for Sick Children. And my journey ended here by accepting a staff position at the Metabolics and Genetic Department at the Hospital for Sick Children.
My name is Aisha Wada. I am a medical doctor from Nigeria. I did medical school in the UAE and then moved to Nigeria, where I spent about 5 years independently practicing in very many different specialties, especially in pediatrics. My love for genetics started when I worked for about a year in a pre-implantation genetic diagnosis facility. I became really passionate about trying to prevent and also to treat genetic diseases, especially in my home country. Around the same time, I immigrated to Canada, and I straight away came into the medical genomics program. And now I'm in my second year of the MedGen program, about to graduate.
I'm Karatulan Zulfikar Ali, and I'm a first year student in the Medical Genomics program. I completed my medical school from Pakistan, and then I did my internal medicine residency and some research along with the way, practiced somewhat independently before moving to Canada in 2018. After that, I essentially wanted to find a job, and I was looking into more research-based positions, and I applied at the Adult Genetic Epilepsy Program at Toronto Western Hospital, and luckily I got accepted, and that's where my journey into genetics began. And I fell in love with the aspect where just being able to diagnose patients with genetic epilepsies and giving them a diagnosis with a gene, how that can impact their treatment. And that really motivated me to pursue my career within. Layali, you've always been an inspiration for me since you gave a talk at the Medical Genomics program. And I wanted to know what your journey was and how you came about signing up for the program.
Thank you so much for the kind words first. And I think it all stemmed out from my interest in metabolic condition. I'm not sure you guys if you heard about metabolic conditions. Not a lot of physicians do. I think it's a little bit specific for my country as well, and that's why I first know about metabolic condition. What does it mean? But during my training, my clinical practice back home, I developed this strong interest in metabolic conditions, which is partly genetics diseases. I've seen a lot of kids with metabolic condition back home, and I have always been interested in both like managing those kids, but at the same time, I was always curious about the genetic mechanism behind this disease. So once we settled here after immigrating to Canada with my family, I started applying for fellowships across Canada, and fellowships positions here for international medical graduates are very competitive. So a friend of mine who actually was doing a genetic fellowship at the Hospital for Sick Children at that period, she advised me and she encouraged me to apply for the Master's in Medical Genomics because her thoughts was this will expand my genetic knowledge and this will prepare me for a future as well to work as a metabolic specialist. So I took her advice, I applied. I was very fortunate to be accepted. And this is how all the story started.
Oh, that's really nice.
Yeah, it's nice. And how about you guys? I haven't heard about your stories before, so I'm just curious, how did you hear about the program in the first place?
Let me go first.
Yeah.
So, so first from my background, like 5 years of clinical practice, never had I heard about anything to do with clinical genetics. It was nothing. So then I found myself, I was looking for like a break from clinical. and I got the opportunity to work in our like only pre-implantation genetic diagnosis lab at the time anyway. And while I was there, I realized that pre-implantation genetic diagnosis was a thing because we were like diagnosing embryos with sickle cell, and then the parents could choose to go, with the healthy embryos and things. And so that led me, you know, I was like, what is this
Thinking
genetics
about
of a
doing this,
thing?
yeah.
Yeah. So then I actually enrolled in a course, like Harvard Medical School has this like online course program thing. And I enrolled in the genetics part of it. And that was like, it opened this whole new chapter. And so I was like, this is what I want to do. I was 100% sure. And then I realized clinical genetics is a specialty that what someone can do. And I'm like, this is perfect for me. Like while I was in pediatrics, those were the things that got me interested. You would see a child maybe with some dysmorphic features, and you're like, what does this child have? The parents don't know, the doctors don't know. And there was nothing like genetic testing. So I was sure this was what I wanted to do. I wanted to do a master's in genetics, but how do I go about that? I don't know. So it was just kind of on the back burner for some time until we were moving to Canada. So then I started like, okay, what does Canada have? And I saw so many programs in genetics, masters in genetics and so on, but MedGen was the only one that stuck because it covers everything. I was at the point that I wasn't like interested in any specific aspect of genetics. I just wanted to know everything.
Exactly.
Yeah.
It's comprehensive.
It is very comprehensive. So I studied the curriculum in detail. This was for me. And then even though I had like a short list of so many programs that I wanted to apply to, I only applied to MedGen because it was like, if it's not MedGen, I don't think I'm interested. I want to know everything. So I was like, if it doesn't work out this time, I'll apply next year. And thankfully, so as soon as we kind of planned our move to Canada, at the same time, I applied for MedGen and I got in, and yeah,
Great timing.
I know.
That's
Yeah.
amazing.
Yeah, exactly. So kind of worked out, thankfully. Yeah. What about you?
For me, like I briefly mentioned in the introduction, because of again, like I think similar to your situation in Pakistan as well, at least at the time when I was practicing or I was graduating, genetics was not something that people even thought about in terms of just even a diagnosis. It's more like management of symptoms, not really thinking about the cause, the genetic cause. And so that was not on my radar at all until I moved, and then I started working in the research lab at the Adult Genetic Epilepsy Clinic under Dr. Danielle Andrade. And that's when a lot of the perspective shift happened. And I'm like, wait, like this, like genetics exists, and like there's so much that we can change based on finding out what's in our DNA. And for me, in Pakistan, at least, it felt so complicated, whereas here it's still complicated, but there are more answers. There are more accessibility to testing, diagnosis, treatment, as opposed to back home. And so at one point, I was like, okay, now I know the research aspect. I've seen the clinical aspect with the clinics, and I want to know more about more comprehensive knowledge about genetics. And then I started researching programs, and I was biased towards U of T, the proximity to work, and just U of T being so good at delivering knowledge. And I looked up a couple of programs, and medical genomics, masters in medical genomics really was something that stood out. The major things, like since I graduated so long ago, I feel like you need a refresher. And just looking at the fact that there was advanced human genetics course where you're going to, brush up all the knowledge and learn more and go more in depth was just really exciting. And then biostats and all the other courses that kind of build on your knowledge in a very systematic way was really exciting for me. And then yeah, just one of the most exciting parts also about the coursework was data interpretation part. Because I was really excited. I was like, I see all these results. I see all these variants. What do they mean? Like, how do people look at it and say it's a missense mutation and it would cause protein to not be functional anymore? I want to learn,
part as well,
right?
like,
I'm like,
from the
I want to
whole thing.
learn. And yeah, those were all the aspects of the program that really got me interested in applying. And yeah.
So Q, you're getting to the end of first year now. How have you found it so far?
It's been a journey, to say the least, but a good one. The first thing that I would say is that we start with biostats, and that was a rough ride. But, one thing that I realized, both with biostats and advanced human genetics, the two courses that we took in the first term, and then methodology, we don't realize how much we're learning
I
in the
definitely agree
moment,
with that.
because I feel like we're just going from one task to the next and just trying to like kind of get to the next task, and we're feeling like, oh, we're exhausted, and like that's all we're doing, assignments. But as methodology came along and more advanced human genetics came along, I was like, I actually understand these things. And I did not before, so it has to be the first term that gave me that knowledge. Looking back, I feel like I did not realize in the moment how much I learned from advanced human genetics, just the patient perspective that it brought, the basic ICYMI videos by Dr. Stiles that would help refresh all the knowledge, and then all the assignments that in the moment felt like, why am I doing this? But
I
then
know. It's
you
actually a
later
lot,
on,
but yeah, you learn so much. I think probably like when you read a paper, like maybe like towards the end of advanced human genetics, and if you compare that with the first,
time I
it's
read the
probably
paper,
very different. Yeah,
yeah,
because you realize you actually have learned a lot in that time.
You're right.
Yeah.
It's the same as well for me. I think I didn't realize how much I learned until I was done with the master's and was practicing, actually. And I feel with you, like the biostatistics was tough. I still remember those tough assignments, the late night I spent doing the assignment. But again, looking back now, I was like, I'm so grateful I did that. I learned that because actually I'm using those skills now to do my own research, to do my own papers, I understand the concept, right? Before I was like, nothing. But it's not just biostatistics, like I mentioned. Overall, I felt like the program was full of new knowledge, at least for me. I learned new skills that I usually use it and on a daily basis in my practice. Genetics, definitely. But the most, I think, for me as a practicing physician right now is communication skills. I didn't realize how important this course was until I was practicing. And I remember we have this assignment where we're supposed to rewrite an article in a late term and do these videos or webinars in a late term. And at some point I was like, I'm not sure how this would be helpful for me as after leaving mid-gen. But actually I'm doing that every day in the clinic with my patients, especially with disclosing genetic results. If I don't use late terms, no one knows anything about what we're discussing. I learned a lot from that. And I think that has created as well a relationship with my patients, a better relationship with my patient because I use those late terms, the way communication, the way that we communicate with them, it's different, like just saying medical terms, I guess, that they don't understand. And trust me, some patients wouldn't say a word about it. Like they will just hear this medical term, and because maybe they are just scared to, for you to think that they're not at a higher level of education, they might just say nothing. And that's why I use all the skills that I learned from MedGen, and usually with my disclosures, with my communication with patients, I'd always use those terms and the same way that we, I think, learned from this master. So definitely it was an amazing course.
That's nice.
Yeah, it was very nice.
Yeah, that is a very interesting perspective because I can imagine when a patient comes to the clinic to you, they have so many nerves, they're anxious, they're like so worried. And if medical jargon is being thrown at them, it can just scare them further. So just the ability, like just to have a physician who can actually come down to their level.
And genetics specific.
And actually, it's a skill that you have to learn. So I have to be honest, if I didn't take in the master's, I'm not sure if I would be able to do it, right? Not every physician can do that. And I was so grateful that I learned that. So that was very helpful, I think, for me during my practice.
I'm really looking forward to the course because I'm not there yet.
But we got into that. Like, I mean, I just came out of that, so it's really, I mean, it's nice to see that it's translating like into, helping you in the clinic, because it's actually a lot like in communications and then even in the ethics. These are some parts that you kind of don't go into as a clinician, not that much anyway. And then when you bring it specific to genetics, it's so much wider than you would imagine. So the fact that we went into all aspects, we covered everything in communication. So you talked about translating to lay audiences. How about like writing news articles, communicating in different forms, making a webinar. I enjoyed that. Well, no, it was hard.
It was hard, but it was fun.
When you see things on YouTube and so on, you don't realize how difficult it is. You actually have to be educating. So we did a webinar like covering variant interpretation. That's like one part that I'm really passionate about, variant interpretation. So thankfully, I found a team that was also interested in that. And then we did a webinar on variant interpretation, like towards clinicians. We thought it was going to be, well, we know variant interpretation, but going through that process of actually being an educator to the clinician, it was really nice to be able to do that in communications. And then I think one of the most amazing aspects for me in the second year was variant interpretation. So, we got to do a deep dive, just like you said, you want to know how do you look at a variant and decide what it does. And we did just that. And at the end of like the elective, you realize, oh, I can do this anywhere. And then, when it came to the practicum, then I was able to actually, interpret variants. You look at it as an expert. You're not just like, what is this? You are, by the time you get to the practicum, you're actually an expert. So yeah, it's quite amazing to be able
It's
to do
coming
that.
up soon, and I can't wait.
Yeah. I actually did 2 electives at the same time.
Oh,
Crazy.
that.
But then the other elective I did was the research.
Right.
So, being able to go into all the new cutting edge research, and we had lectures and sessions with the actual PIs of those labs. Yeah, it's very amazing. So yeah, it's just like so comprehensive, and it just basically suited everything I was looking for, which is quite amazing.
It's amazing.
Yeah.
It definitely changed how we practice. And I think for me, and I think it's going to be for you as well, like, because physicians here, it's not like you talk about the genetic, like the variant interpretation, and you'll be surprised that only geneticists here can do variant interpretation. I thought it was something like all physicians here in Canada can do or understand, but to my surprise, it's only geneticists. And that's why I think after I graduated and started working, I kind of was a little bit standing out from other physicians because of this unique knowledge and skill that I have, and other physicians like who has a pediatric background, for example, not geneticist, they were not able to do it. Yeah. So this was an extra bonus as well for me.
Being able to see the reports and actually be able to...
it's not just about the report. Now I can say I don't agree with this. I don't agree with this interpretation. I do my own interpretation. I discuss with the lab, and this is something I haven't imagined doing it before doing my master's. But actually now I'm very confident actually in doing that.
That's interesting. So is that in the sense where, like, if a lab reports a variant, and then the patient, though, the phenotype is really fitting to that variant, is that when you were disagreeing?
It's not just the phenotype. Sometimes I always do my own variant interpretation. I look at what the lab reported, but usually because my patient will have a lot of questions for me, right? Lab will say this was mentioned in this paper, this is what they're expecting, but they want more from me. So, and because I have like this background in variant interpretation, I will do my own search. And sometimes I would say, I don't agree this is a variant of a non-significant. I think this is more leaning toward benign. And this is how I counsel, for example, my patient. Although it says this, but this is what I think, or it's the opposite, right? And this is, again, a skills that I'm unique, I guess, with a background as a pediatrician to have it. So, yeah, that make me more confident. And that's why I'm very confident as well with ordering my own genetic testing, doing my counseling, doing all of this stuff because of the knowledge that I took from the medical genomics. And again, I haven't realized the amount or the knowledge how much I learned until I actually started practicing.
That's awesome. Yeah. I did have a question about the practicum because I know within the program, the clinical stream practicums can look a little different than the lab-based programs. So would you want to tell me a little bit about, and both of you, I know a little bit about yours, but for you, I don't think I am aware of the...
So my practicum was like a mix of my fellowship and my master's. So what I appreciated the most about the master's program overall, how supportive, flexible, and understanding the faculty were throughout the program. So after I finished my first years of master's, I was offered the fellowship position at the hospital for sick children, right? And this is an opportunity I was looking for, but at the same time, I wanted to finish my master's. I didn't want to just leave it at that point. And I was so grateful to Erin and to the program who worked with me to make sure that I can do both together. And then Erin came with the idea, you can just leave for 1 year, leave of absence for 1 year, do first year of your fellowship, and then with the second year of your fellowship, you can just combine the second year of the master's with the second year of the fellowship. And because my practicum was during the second year, I combined both. So I was working with a neurology team who were doing a paper, and they were looking for someone who can do variant interpretation for their findings. And I volunteered, and I took part of this study, and I did all the variant interpretation for this study, which was about, I think, a patient with epilepsy. And it was as well part of my practicum. So I did, at the same time, I have a paper on my name, and at the same time, I did my practicum. I did the thing that I like with doing variant interpretation. So it worked.
It was a perfect combination.
Perfect, yeah. Perfectly for me, yeah. Yeah. How about you? What did you do for your practicum, Aisha?
Yeah, my practicum was, I basically worked as a genome analyst with sick kids, also with a genetics research team in sick kids. And I interpreted variants for 2 different projects. One was to do with prenatal genetics, and the other was to do with, also in the prenatal field, but one was testing fetuses to see if they had any abnormalities, what the genetic cause could be. And then the other one was trying to test for some prenatal variants that could contribute to a final phenotype. So I did basically all the variant interpretation for that. I also did a lot of bioinformatics in my practicum, which a clinician doesn't usually do.
No.
I did all the coding on the command line, everything. Just so basically I was able to take a genome file, so a FASTA file, a genome file. I made the pipelines, ran it through those pipelines, got my variants, and then did quality control, everything, and then interpreted the variants. So it covered everything. Yeah, it was nice, all encompassing. Yeah.
This is very impressive.
Yeah.
This is very impressive.
It was amazing.
Yeah. Nice. And so what are you looking for after MedGen? What's your aspiration? Aisha, I'll start by that since she's finishing soon.
Yeah, I just finished my second year. I think I'm happy that I kind of got everything I wanted to get out of MedGen. So my plan before coming to MedGen, and it still is my plan. I think I would say, like, let me put it as like short term and long term. In the short term, I really want to work in genome analysis. I think that's gonna make me become more of an expert. Like, I understand everything about genetics. I've read so many papers, things like that. So I want to be so good at just being able to see a variant and figure out what it's doing, because I think that skill will benefit my patients in the future. So let's say, for the next 3 years, 4 years, I would really like to do that. But my long-term goal is to become a clinical geneticist. So it's nice to hear, yeah, how useful it was for you, to work in genetics, because that's where I would like to be headed. And I especially want to be able to contribute to, like, making clinical genetics a thing in my country where it doesn't really exist. So since I've been in pediatrics, I've seen many patients, and I can list at least 10 patients that I came across that would have benefited from this skill today if I had it at that time. So, I really hope to be able to impact clinical genetics care, in the future in my home country. Yeah. Yeah, I hope so. Hopefully.
How about you, Ali?
So I guess I like how you broke it down into short and long-term goals. But I guess towards the end, a long-term goal is to get back into clinicals and be able to practice what I learned from this program, and use my clinical skills and research skills along with the variant interpretation aspect. So yeah, that's the goal eventually. And in the short term, I would like to contribute. So one thing that we talked a lot about the current era of genomics is how much data we're generating, right? And there is so much data, but not enough people or not enough time to interpret the variants. And this is something very similar within our lab as well, where we are sequencing a lot of patients, specifically in research, but we do not have the manpower to do the analysis or the expertise within, like, in-house. So using these skills, I would like to be able to contribute specifically for patients who are having really bad epilepsy, who are on multiple medications but are still not able to have their seizures be controlled. And we are looking for quick answers where I can step in from my day-to-day role and be able to run the pipelines like a superhero, like you said.
Yeah, you're literally a superhero.
And be able to kind of just parse through those variants, see if we can find anything that can maybe provide them answers. So that is a short-term goal, but again, eventually going back into clinicals would be ideal. Yeah. And I know, like, this is a lot of our aspirations, but I would like to ask you as well, like, how has it been, like, currently, and is there anything that you would like to? I know your practice is really busy. You work in metabolics, like, everyone's constantly, like, putting urgent requests on you, but is there a dream project that you have that you would like to kind of, if time were of no object, you would want?
I will have to be honest at this point. I think I already like working in my dream jobs, right? I'm doing metabolics. This is what I wanted to do for years now. I'm enjoying every second of it. And I have to add here that I'm so grateful, and I truly believe that my genetic knowledge and my skills that I've learned from this program, again, made me stand out from other applicants when we applied for the same job at that point. And actually, I'm practicing this on a daily basis. I'm practicing all of these skills on a daily basis with ordering genetic testing, interpretation, counseling families, doing variant interpretation. I'm not a superhero like you, Aisha. I don't do like pipeline and bioinformatics. I enjoyed biostatistics, but I don't practice it in my day-to-day. but I guess I'm practicing the rest of the curriculum that
You
we
can
did.
only do so much.
Exactly.
You can only do so much.
So at this point, I think I'm very satisfied. I'm working more about doing my own research, and I think hopefully there I would be practicing my biostatistics and kind of research tools that I learned as well at that point. But so far, I'm satisfied where I am.
It's amazing to hear that you are living your
Yes.
dream, and hopefully we will be able to get there one day
I'm
too.
hoping that you will be. I think we are in the era of genomics right now, and I believe genetic testing nowadays has become like a regular and important part of the medical care. And actually, the trend now is to push more and more and encourage more and more physicians who are not geneticists actually to order their own genetic testing. And I truly believe medical genomics program, because we all know the curriculum, and hopefully you agree with me, it will be the best the best choice for those physicians to help them, I think, feel more comfortable, more confident dealing with genetic testing and results during their daily practice. So I think I'm seeing that we're there, and that's why I said I'm pretty sure you guys eventually you will have your opportunities, because I think now we're looking for physicians who have genetic backgrounds and can deal with genetic information. So I'm pretty sure you will achieve your
I hope
dreams
so.
and goals.
Thank you.
Again, I'll be happy to help you with that.
Thank you so much. Thank you.